Okay, so next frequently asked question is, does testosterone replacement therapy, specifically bioidentical testosterone replacement therapy, cause cancer? Now, this is a very serious one, but the simple answer is no. There's a lot of misconceptions out there, and I'll explain why. I mean, it makes sense that people would think this way, but once you understand the literature and what's available out there as far as the studies that have been done, it just doesn't make sense. Now, there really is no scientific basis for why someone would say that testosterone causes prostate cancer, but I can show you where the confusion is. I mean, if testosterone caused prostate cancer, then we would see a spike in prostate cancer incidence when men were at their youngest and having the highest level of testosterone. I mean, you have your highest level of testosterone at around age 18, and prostate cancer around the age is almost unheard of. I mean, you really get prostate cancer when you're much, much older. Okay, so let's clear up the misunderstanding with the whole testosterone causes prostate cancer growth. So I made a little pretty drawing here for you. So first, this is a prostate cancer cell. And prostate cancer has certain receptors on it that testosterone can attach to. So testosterone in this drawing is the blue. So all these receptors have testosterone attached to it, and that means it can potentially increase the growth of the prostate cancer cell. That sucks, right? But here's the thing. This is with a normal level of testosterone. So let's say it's at 500. There's still only a certain number of prostate cancer receptors. So if your number is 200, let's say, go down. That's a pretty low testosterone, no change. There's only a certain number of receptors there. So as long as you even have a tiny bit of testosterone, your risk is going to be the exact same. Whether you're at 100, 200, 500, as low as 90. Now, 90 testosterone is really low, but basically your risk of prostate cancer growth is the exact same at 90 as it is at 1,000. It still only has so many receptors for testosterone. So why do people think that decreasing testosterone decreases prostate cancer growth? Well, here's why. Because of physical or chemical castration, which eliminates all testosterone. So if your testosterone level was at 0, so that means no testosterone whatsoever, no function for anything that testosterone controls, then prostate cancer can actually decrease. That's because you're having nothing attached to these few receptors. Those few receptors are empty, and so the prostate cancer stops growing and can actually decrease in size. So in conclusion there, I hope you understand this, and if you don't, please let me know on the comments so I can better explain it. But as long as you have a tiny bit of testosterone, your risk of prostate cancer growth is the exact same even if you increase it. So if you're starting and you come into the clinic with a level of 200 testosterone and we supplement your testosterone and bring it up to 700, let's say, your prostate cancer growth risk is exactly the same. The only way to eliminate that risk is to have no testosterone whatsoever, and that's not going to happen. So not only is the idea that testosterone increases your prostate cancer risk insane, but testosterone even lowers your risk of dying from cancer and the number one killer, cardiovascular disease, and all-cause mortality. That means that if you have low testosterone, you're more likely to die from any disease than you are if you have optimal testosterone. And why is that? I mean, that sounds crazy, right? Well, it's not, because there are testosterone receptors in almost every tissue in the body. So for your bones to function properly, for your heart to function well, for your brain to function at optimal level, you need testosterone. So all of those things start to get out of balance when our testosterone's low. So it makes sense that over time, that could cause some real damage. And one of the most overlooked things with obesity and type 2 diabetes is testosterone levels. If you have low testosterone, you're far more likely to have diabetes, far more likely to have obesity. And this definitely contributes to all kinds of elements of our overall health and definitely increases our risk of all mortality. So anyone that you talk to that's really specialized in hormone therapy or really has done a lot of research on this topic is going to tell you that the benefits of having optimal testosterone and being on bioidentical hormone replacement therapy far outweigh the risks for most people. Now, you do need to talk to your practitioner, and every single person is different, and there are certain things that make it not a good treatment for you. But overwhelmingly, most people are going to really benefit, and it's the best thing you can do for your overall health. This was just one of the frequently asked questions about male bioidentical hormone replacement therapy. So please go to my YouTube channel to see the video in its entirety. Bye!